Let's look at the lymphatic system and the fascia system. So a brief introduction into the lymphatic system is the lymphatic system is a part of your immune system, and it is its own kind of circulation of lymph fluid through the body, that its job, very succinctly put, is to take lymph fluid from your tissues and return it back into your bloodstream. Okay. Now, what we specialize in its Sterling structural therapy is the fascia system. So these are two very helpful diagrams to help us better understand the fascia system. This is taken from the work of Tom Myers. We also have a little demo tool that I'm going to use to help you better understand how the fascia system is going to affect your movement, and your movement massively affect your lymphatic system. So your circulatory system, right, your blood, there is the heart that is like a pump, and it circulates the blood right through the body. The lymphatic system doesn't have a heart to do this. The way that it drains and continues to work smoothly is primarily through our movement. So the more we move, the healthier the circulation through that system is. A great example of the opposite of that, if you're stuck on a tremendously long flight, right? At the end of that flight, if you took your shoes off, you try to put your feet back in your shoes and they almost don't fit because everything is swollen because you haven't moved for about 13 hours, and everything with gravity is just draining to the bottom of your feet. And because you're not moving, it's not circulating back into other areas and into place, and that can cause some issues, right? So that would be an extreme, but a normal, right? Not a pathological example of this, okay? So we specialize in the fascia system, and the fascia system is a whole new way of looking at human anatomy and a whole new way of addressing chronic pain conditions. So normally, if you've got a low back problem, you get imaging done for your low back, and the x-rays and the MRIs are going to show if there's any kind of issues here. And of course, where would people then treat you? At the low back. Now, a few fun fascia facts. Fascia does not show up on MRI, CT scans, and x-rays. It shows very lightly on some MRI images, but not sufficiently for diagnosis. So when someone has an isolated problem at their back, as an example, and the imaging is done there, and all the treatment goes there, but they end up still having back pain, right? Does that mean that possibly, yes, there's that disc issue or stenosis or back issue, but it's a part of a bigger problem, okay? So I'm going to do a brief demonstration over here, right? With Mr. Fascia over here, so you can have a better visual of how fascia is a system, and a restriction all the way over here on this side could actually negatively affect the low back on the left, as an example, okay? So right now, we've got a healthy fascia system. So if I ask Mr. Fascia to just rotate his arms side to side, right? Rotate his torso, great, no problem. He's got freedom of movement, good. And then lift his arms all the way up, right? No problem. No restrictions, right? Now I'm going to change that. I'm going to give him a fascia restriction. So I'm going to give him a fascia restriction all the way, actually, at his right hip, okay? So first of all, right, in this position, Mr. Fascia, go ahead and try to rotate your torso and arm side to side. The other side. Give it a shot. Good. And back to the other side. Give it a shot. Try. Right? He's basically almost just moving his arms. He's lost a lot of mobility, right? And then try to lift both arms up for me. Really try. That's all he can do. Good. Drop them back down. Now, I'm going to keep holding on here, right? You saw how that negatively affected his spine mobility. Imagine him trying to play golf or tennis with this, right? You saw how it affected his shoulder mobility. Imagine what's happening at the neck. Now, with this pattern, it's causing a right side bend in the spine, and he could have back pain on the left, and the imaging is going to show a disc bulge on the left, okay? Because with this pattern, as we bend to the right, the vertebra gap on the left and the disc gets pushed out. Now, this person can get specific treatment, right? Just for their low back on the left for that symptom, and it's not going to go away, and they won't gain their pain-free ranges of motion unless we look for where the fascia restriction is coming from to free them up so they can rotate through their spine again. Go ahead and rotate, yeah? Good. And then lift their arms freely without it pulling on their back, okay? So how does this affect, right, the lymphatic system? Well, as we mentioned, the lymphatic system relies on efficient movement to circulate properly and do its job, and that affects your immune system. This is extremely important, okay? So imagine, right, who is going to most probably be more active, be more likely to be active, right? The person who has all these freedom of movement, or, right, that person that is all restricted down and bent down and can't really move, right? So obviously, this position is the optimal position. So what we see over and over with people who come to see us for a multitude of chronic pain conditions, from low back to neck to knees to hips, to neurological conditions, one of the main ways that it affects their daily living is it restricts their movement. I mean literally restrict the movement that they can barely walk from the car to the grocery cart. I mean daily living that it hurts to get in and out of bed properly. But I absolutely am saying that if someone is having an issue by now with just walking or standing for more than half an hour somewhere without pain, what are the likelihood that they're able to actually work out, get a good workout, and not be in horrible pain as a result? It's not possible. There's a direct correlation. What happens is that freedom of movement and activity shrinks. They have to stop doing things that they want to do or should do or could do. They simply cannot. So what we do is we optimize first pain-free, more static position like sitting and standing, then walking and sleeping, and then by session 7, sometimes session 6, every single person, the person that came to see us that's actually in a motorized wheelchair, or the person that came to see us that is a professional athlete that is experiencing issues, our goal for everyone from their starting point is, okay, let's get you back to more activity in an intelligent way. Okay, so that is going to massively affect the health of their lymphatic system. Okay.